Hello, I'm Dr. J.C. Smith. I'm practicing chiropractic for the last 30 years here in Warner Robins on Russell Parkway. Today I'd like to talk to you about two epidemics that we all face. The epidemic of back pain and the rash of unnecessary back surgeries. Most people don't realize, but in the past 15 or 20 years there's been a lot of research showing that most back surgeries are not only ineffective, but they're unnecessary. And today I'd like to share with you the scientific information. So if you have a back pain problem, and most people do, or if you're contemplating back surgery, or have already had back surgery like some have, then I want you to know that you can have an alternative to shots, drugs, and more surgery. And today I'm going to share with you a lot of scientific information to that effect. Actually, a few years ago, a friend of mine, an orthopedist here in town, shared with me the fact that Macon is the back surgery capital of the state of Georgia per capita, and it ranks 4th on the list nationally. And this is rather odd in light of all this new research that has shown that much of what they do is ineffective, costly, has many serious side effects, and most of all, that chiropractic care and conservative care in general is just as effective in the long run. Actually, the research has shown that the United States as a whole does 4 to 5 times more back surgeries than Britain and Scotland combined. What does this tell us? That Americans have 5 times weaker backs? Or maybe that there's 5 times more back surgeries done in this country than elsewhere? And in this day of evidence-based healthcare, and we're all looking for cheaper ways to solve these astronomical costs in healthcare, chiropractic has shown to be more cost-effective, safer, cheaper, with longer lasting results. In fact, recently testimony on Capitol Hill by Dr. Tony Rosner, PhD, who is an expert in this field, has actually said that today we can argue that chiropractic care, at least for back pain, appears to have vaulted from last to first place in treatment options. Even the Academy of American Physicians and the American Pain Society has endorsed, quote, spinal manipulation and exercise for acute, subacute, and chronic low back pain. Indeed, it's a new era in treatment for low back pain. And once you see what the experts say, as we're going to show you, you can make an informed decision about the best treatment for your back pain problems. But first of all, this epidemic of back pain is just astronomical. Do you realize that 90% of American adults will have a back attack in their lifetime? Some will have 6 to 7 episodes. And the facts also show that there are now over 200 treatments for low back pain, most of which are unproven and ineffective. Yet the public isn't being told of this recent research. Just to give you an idea how large this problem is, in our country alone, back pain costs $100 to $200 billion annually. A lumbar fusion can cost as high as $169,000 according to the research. Lumbar laminectomy costs $82,000. Cervical laminectomy, $60,000. And a cervical fusion can cost over $112,000. And again, these high costs also come with high side effects and long-term problems. For example, not only are spine surgeries costly, but research has shown that patients are rarely told beforehand that there are 80,000 new cases of failed back surgery per year in the United States. 20% of them have reoperation rates. 71 to 95% of lumbar fusions will never return to work. And up to 90% of these surgeries are now deemed unnecessary. But again, in Middle Georgia, people are not being told this. Basically, the medical profession doesn't want to let this cat out of the bag. It's just too much money they're making. I dare say if the hospitals only did what was back surgeries that were necessary, most of them would go broke, because back surgeries are the number 2 surgeries other than heart surgeries that are done nowadays. But again, in this era of evidence-based medicine, which means you have to prove what you do is effective before they're going to allow it, well, things are changing. And medical experts now clamor for a change in the management of low back pain. Worldwide research has shown repeatedly that back fusions, shots, and surgeries are not safe, they're not effective in the long run. According to Richard Deo, a leading American medical researcher, the irony of so many back surgeries is dumbfounding considering this research. As he says, People say, I'm not going to put up with it. But we in the medical profession have turned to ever more aggressive narcotic medication and more invasive surgery. A Scottish orthopedic researcher, Gordon Waddell, has also said that low back pain has been a 20th century healthcare disaster. Medical care certainly has not solved the everyday symptom of low back pain and even may be reinforcing and exacerbating the problem. But, he states, up to 40% of Americans now seek chiropractic care for low back pain instead. As you can see, there's a change in attitude by the experts about what is the best care overall. Dr. Waddell continues to say that back surgery has been accused of leaving more tragic human wreckage in its wake than any other operation in history. I believe that someday back surgeries will be just like hysterectomies, tonsillectomies, and appendectomies that were once popular and routine but now considered unnecessary surgeries. Back surgeries are now at that point, and most of the world knows it, except again here in Middle Georgia, which is the back surgery capital of the state. Dr. Waddell also admits that there is now considerable evidence that manipulation can be an effective method of providing symptomatic relief for some patients with acute low back pain. Again, Dr. Richard Deo, another American researcher who's written a book, Hope or Hype, mentions similar sentiments among ethical spine surgeons. Again, not all spine surgeons are doing unnecessary surgeries, but many are. As he says, quote, some surgeons, like Dr. Edward Bazell at the Cleveland Clinic Spine Institute, believes that too much spine fusion surgery is being performed. He estimated to the New York Times that less than half of spine fusions being performed are appropriate. Another neurosurgeon at Yale agreed that too much spine surgery is done, saying, I see too many patients who are recommended for fusion that absolutely do not need it. Again, this is from a Yale University neurosurgeon. What was most interesting is back in 1994, the United States Public Health Service did a landmark study of over 4,000 articles on back pain treatments. It took them 2 years. They had an expert panel, 200 staff members. This was a landmark study, as I said. And they mentioned, again, that back surgery is helpful in only 1 in 100 cases of back problems. And moreover, surgery increases the chance of future procedures with higher complication rates, a fact that patients are rarely told before surgery. They also mentioned that, quote, there appears to be no good evidence from controlled trials that spinal fusion alone is effective for treatment of any type of acute low back problems in the absence of spinal fracture or dislocations. Moreover, there is no good evidence that patients who undergo fusion will return to their prior functional level. Just this last year, there were 2 interesting studies released that never got to the public media. It was well mentioned in the scientific journals, and I'd like to share those with you. One was a study done, headed by Dr. J.N. Weinstein of Dartmouth Medical School, and it was a study that compared fusion with non-invasive care and found that people with ruptured discs recovered whether or not they had surgery, and that there's no harm in waiting. Often people in pain are rushed into these surgeries thinking that they're going to be helped immediately. Well, that's just not the case, as they found, and there's no harm in waiting. In other words, try conservative care like chiropractic care first. You're not going to die or be permanently impaired if you don't have surgery immediately. And most never need surgery. But another study done by Dr. W.C. Puel from the Netherlands, they compared discectomies, which is where they just trim the disc to stop leg pain, with, again, natural conservative care. And they found that at the 6-month point, there was no difference between those who had surgeries and those who didn't. Just like the Weinstein study found 2 years down the road, people who had surgery were no better off than those who don't. So don't think that surgery is going to cure you this once and for all. In fact, they have found that people will have relapses because even though they do the disc isn't the main problem, as they're now finding. This is what's most interesting, is the whole premise of back surgery has been built on the disc theory, that you have a bulging disc, a herniated disc, a ruptured disc, a degenerative disc, any kind of disc abnormality. Some doctors will still tell you that that's the reason you need surgery, and they'll show you on x-ray, and I can show you x-rays myself, but people had those disc problems before, and they have them after they're well. The disc is not the main problem. Again, Dr. N.M. Hadler, an M.D. orthopedist and author of The Last Well Person, his book, and also he's a professor at the University of North Carolina School of Medicine. He believes that, quote, ruptured disc and bad back are terms that deserve to be regulated to the historical archives. That says a lot. Rather strong words, considering this man is an orthopedist at a renowned medical school in North Carolina. But unfortunately, here in Georgia, the outdated disc theory is very much alive. And the problems with the disc theory is, as I said, disc abnormalities exist in people who have no back pain. This was shown right up here at Emory University in 1990. Dr. Scott Bowden, a renowned orthopedist and surgeon there, did studies, MRI studies on people with no back pain. And he found that half of them had disc abnormalities, but they had no pain. And then he did MRI studies on people with back pain, and many of them had no disc abnormalities. So as they're concluding that, as Dr. Hadler has written here, the discal hypothesis, the idea promulgated 70 years ago that the ruptured disc is the culprit, has not withstood scientific scrutiny well. It is largely untenable for axial pain and marginal for radicular pain. Yet, as Dr. Hadler says, even though there's a lot of erroneous attributes of the disc theory and the failure of the drugs, shots, and surgeries, he actually concluded maybe you're better off not going to a doctor. Again, very strong words from a medical man himself. But on the other hand, you may not want to go to your family doctor because, in fact, research has shown that the average family doctor is not well skilled in back problems. In fact, in med school, they have 1 to 4 hours of classroom activity on the musculoskeletal system. We chiropractors, on the other hand, have 2,000 hours of schooling in just the musculoskeletal system. As I tease some of my patients, asking your local MD about back problems, you could ask your dentist and he'd give you the same sort of explanation, very superficial and certainly not in depth. But again, you definitely should find a good chiropractor when you have these back problems. And indeed, today's chiropractic is not what your grandfather experienced. Chiropractors today are better educated, better trained, and they are in effect now considered the cultural authorities for non-drug, non-surgical solutions to back pain. And again, this evidence is coming out more and more and more. Dr. Deo again agrees that disc theory often leads to false positives. In other words, yes, we can show you a disc pathology, but it doesn't necessarily mean that's causing your pain. Because again, most of these disc problems began years ago in childhood, when they found that 2/3 of adults today, their problems began when they fell off bicycles, roller skates, skateboards, football accidents, falling off horses like I have. But what happens, the accident goes unseen, uncorrected, and then 20 years later, people come to see us after just doing something like a sneeze, and they wonder why their back goes out. But again, they were just an accident waiting to happen after that initial childhood injury. So Dr. Deo agrees that the disc theory leads to these false positive diagnoses, which again means, yes, you have a disc issue, but it may be not the cause of the pain. They actually liken it to having gray hair, saying, yes, you have gray hair, but that's not causing your back pain. And then he went on to say that the earlier frequent use of tests like CT scans and MRIs is discouraged because the disc and other abnormalities are common among asymptomatic patients. Degenerated, bulging, and herniated discs are frequently incidental findings, even among patients with low back pain, and this may be misleading, and it often is. So if you've been told you have a disc problem, must have surgery, I suggest that you keep in mind what the researchers have to say, that it may not be the disc, and indeed, if it isn't, then surgery will be unnecessary, ineffective, and probably disabling. Actually, Dr. Deo jokingly refers to these disc abnormalities as incidentalomas. Sounds real serious, but what he's saying is they're incidental. But the problem is that, as he points out, 97% of back pain is mechanical in nature, and only 1% of back problems has anything to do with the disc. And we see it in here. Many people come in, have been diagnosed with a herniated disc, and will adjust their spinal joints, and suddenly the disc deflames. So let me explain to you what is really happening when you have a back attack. In other words, discs don't slip, but joints do. A disc is cartilage. It's not muscle. It doesn't move. It just is like a shock absorber. It glues one bone vertebra to the next. So it doesn't slip. That has never been true. Yes, they can swell. They later can degenerate. but it all happens to the mechanics of the spine. So let me show you the actual mechanics of the spine with this model. What we have here is the spine from a patient who didn't pay her bill. We're tough on collections. Now really, it's plastic, but let me give you a little anatomy lesson, because most people don't know a lot about the spine because they never see it. But nonetheless, there's 24 vertebrae interconnected by 23 cartilaginous discs. There's no disc at the top vertebra. That's why it's very movable. And when you have a whiplash or neck injury, you'll misalign that top vertebra and have those intense headaches and cause other kind of facial problems. And then down at the back, at the lower part, you have two sacroiliac joints next to the sacrum. And again, there's no disc in the sacroiliac joint. But the key point to remember about the spine is that not how many, that there's 24 vertebrae and 23 discs, but there's 137 joints in the spine. And that's the key with most back problems. And again, long before you slip a disc, you slip these spinal joints. You can get a closer view here, and that's the point. Here's an example. Actually, this red bulge is of a herniated disc. You can see it. But again, a disc doesn't bulge because it wants to. It only does when the mechanics of the spine force it to. And that's the key. Once you have that bad fall off a bicycle or play football or have the car wreck or sleep wrong and slouch too much, and then they finally come to see me when they're years older going, how come I'm in pain and why is my spine all messed up? Well, it's years of misalignments from childhood injuries, car wrecks, sports injuries, all these traumas that the normal person will have in his or her lifetime. So what we like to do in chiropractic is, yes, acknowledge that some people do have disc issues, and we do treat those as well. But the big point is to look at how your alignment is. In other words, just like your knee should be properly aligned, so should your spine. In other words, you should be straight with a level pelvis. But again, most people aren't. They've fallen off bicycles, tilting their pelvis, then they start getting the scoliotic curves later in life, or they have whiplashes, and instead of having a nice curve, they get reverse curves in their neck. All these distortions occur. And when that occurs, mechanically, you're going to put more pressure on the joints and on the disc. And then when the disc swells, it hits the nerve. So the pinched nerve is the last part of this sequence. The first part is the misalignment of the spinal joints. In fact, research has shown that most people have compression problems, and just from sitting. When you sit, you put 150% more compression on your low back than standing. Obviously, when you lie down or recline, you take pressure off. But when you sit all day and slouch, you're just misaligning and compressing these joints. You jam them together. That will cause internal swelling. Again, it's like standing on a sprained ankle. It will cause internal swelling. So we chiropractors analyze the spine as a mechanical problem. We don't just look at the health of your spine, as medical doctors are prone to do. We want to see how well does it function. Is it aligned properly? Is it moving properly? Because joints are supposed to move. And does it have enough strength to maintain it afterwards? This is why a lot of people have the relapse of 6 to 7 episodes, because even if they get spinal adjustments and pressure off their spinal joints, they don't do the next step, which is to strengthen all these little muscles that go around the spine. Again, that'd be like a football player having his knee surgery but not having the rehab. You're bound to have problems, especially as you gracefully age and you start having deconditioned spinal muscles anyway, and then you slouch too much, and then you twist your back lifting them properly, and then you wonder why your back goes out. Bob Pope used to joke, with people saying, you're getting old and your back goes out more often than you do, but it's true, and it will. But again, the main problem with most people is their spines have mechanical problems. And now while back surgery is not considered the solution, back surgeries do not realign you. They do not stabilize your spine. They just more or less fuse you in a misaligned position. This is what the recent international researchers have shown. For example, they're quoting from the Back Letter, which is a professional journal dedicated solely to back pain treatments. They recommend chiropractic as a proven treatment. Quote, numerous international guidelines have endorsed the use of spinal manipulation as a treatment for acute back pain as part of an evidence-based treatment plan. Dr. Richard Deo again wrote in the New England Journal of Medicine that chiropractic is the most common choice, and evidence accumulates that spinal manipulation may be an effective short-term pain remedy for patients with recent back problems. What's interesting, though, is how slow the medical profession has been to embrace this new research. Actually, the National Academy of Sciences mentioned years ago that it takes up to 17 years for new knowledge generated by randomized controlled trials to be incorporated into medical practice. 17 years. That's a whole generation. Dr. Alf Nakelmason, MD, regarded as the godfather of evidence-based spine care, suggested that, quote, many in the medical community, and spine surgeons in particular, have been slow to embrace the results of rigorous scientific research. As a result, many patients with back pain don't receive optimal spinal care. Many continue to undergo unproven and counterproductive treatments, such as pain pills, muscle relaxers, epidural spine injections, and back surgeries. Again, this is a $100 to $200 billion industry that could be cut by 90% if the scientific guidelines were followed. So what causes it? Again, as I mentioned, if you don't slip a disc, what happens? Well, you slip joints. According to Dr. J.L. Shaw, an orthopedist and researcher, he was quoted as saying, joint dysfunctions are the major cause of low back pain, as well as the primary factor causing disc-based degeneration and ultimate herniation of disc materials. And again, it gets back to you have to misalign the joints first, then you start having disc and pinched nerve problems. Dr. Shaw also mentioned that most low back herniations, again shown here, start in the sacroiliac joint. Some of you may be old enough to remember the old comedian Jack Benny. He used to joke about his sacroiliac. Well, most people thought he was joking, but he was perfectly serious. The sacroiliac joints are these side joints. Again, you can see them here. There's no disc there. And this is a joint that just butts up bone to bone. And when that slips, you have excruciating pain in the side, on the sides here, in the sides of your buttocks. And that may radiate around into your thigh or into your groin area. It will not go beneath your knee, but nonetheless, it's right in the buttocks area. And most of my patients who come in seeking our DRX decompression table don't need it, because I adjust the sacroiliac joints and their pain goes away. I myself have had severe sacroiliac problems from improper lifting and twisting. Unfortunately, because there's no disc in the sacroiliac joint, most medical doctors completely ignore it. And for years, they thought it couldn't misalign. Well, believe me, it does misalign. And for those of us who've had sacroiliac pain, you know it does. And again, when the sacroiliac joint goes out, your whole pelvis will twist. And then the herniation begins. And like Dr. Shaw recommends, he said, well, if you adjust the sacroiliac joints and balance out the pelvis, these herniations, which are just swellings, will die down. But the last thing you want to do is go in there and start fusing people in a misaligned position. They still have the sacroiliac misalignments. Now, for those people who do have a bulging nerve that doesn't shrink in size from swelling, then we have the DRX table. The DRX table is a computerized traction apparatus. Actually, there's 6 computers in it. And it pulsates and pulls the spine, creating a negative pressure inside the disc. And it pulls up to 200 pounds per square inch. Again, this is not your grandfather's traction table. This is a highly sophisticated intersegmental table that pulsates and pulls up to 200 pounds per square inch. And that will literally create a negative interdiscal pressure that will suck the herniation back in. I've been on this myself. It's very comforting and relaxing, and it will take pressure off the disc. But only 1% of our patients need this. But it's what I call the missing link between chiropractic care and surgery. And I encourage everyone, before you have back surgery, let us give you a treatment on the DRX. Actually, the treatment consists of 20 visits at 30 to 45 minutes at a time. And you sit there and we'll show you the actual machine here in a moment. But the point is that you can be saved from surgery, whether through traditional chiropractic care or through the sophisticated DRX 9000 non-surgical spinal decompression table. And actually, it is less costly than many of the medical procedures that are ineffective. For example, I read that the average epidural series of 3 shots may cost between $2,000 to $3,000. Well, that's more than the entire program for the DRX 9000. And we do have payment plans for people who don't have insurance, or insurance may not cover it, because we don't want anyone to go broke getting well. And again, if you have any questions about our programs, please go to my website at smithspinalcare.com or phone my office at 922-4091, or just drop by. We'll be glad to give you a tour of our facility and give you more education material so you can make an informed decision about your back problem. And that's the whole thrust in today's evidence-based healthcare movement, is to do a diagnosis and give people choices. And we give people choices. If what we do here does not help you, I do work with neurosurgeons in Macon and at Emory, and I will refer you. Most of the time, patients are sent back to me just being told to be more patient, give it more time, because rehabilitating the spine is not an easy chore. It's not like pulling a thorn out of a paw. It's more like rehabilitating a football knee. And for those of us who've had football knee injuries, you know that's a slow process that takes time to heal, and once it's healed, you better maintain it, otherwise you're going to have a relapse, and that's why most football players do, and so do most patients with back problems. But let me now take you to the DRX room so you can actually see the table and see more footage, some computer-generated images that actually show you how this incredible table actually works. Here we want to show you the DRX table itself. It again has 6 computers that automatically will pull the disc area that is protruding, that has not reduced through regular manipulation. But it's a very scientific table. It pulls at different levels specifically. This is not your grandfather's traction table where it just pulls your whole back. This is angle distraction, actually pulls right at the specific disc level. And again, it takes about 20 visits at 30 to 45 minutes each. It's very comfortable and relaxing, and it's unlike any traction table people have had in the past. Now we will be showing you some computer-generated images of actually how it works. And again, I urge you to come by to take a look at it, see our office. Even if you're interested, I have written a book called How to Avoid Back Surgery with all the scientific references that I've mentioned before. So we really want to show you that there are alternatives to shots, drugs, and surgeries for your back problems. But let us have you now see these computer-generated images. Thanks. I hope to hear from you soon.
During each painless 30-minute treatment, pressure between discs is reduced, drawing water, oxygen, and nutrients to the damaged area. This acts to naturally rehydrate and gradually rebuild the injured disc. As the pressure on the disc decreases, pressure on the spinal nerves is relieved. Bulging disc material retracts, and damaged structures of the spine are healed and rehabilitated. It's hard to imagine that just months ago, all these people were suffering from debilitating back or neck problems, and most had all but given up hope of ever getting back to an active, pain-free life. But then each one of these people learned about the DRX 9000 spinal decompression system and started the treatments that would change their lives.
After the second week of treatment, my numbness was gone.
It meant I had my life back. I could do everything that I normally could do before.
It's incredible. I feel like I've been given 20 years back.